Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, as part of our election series, Dr. Colleen Berry, Chair of the Department of Health Policy and Management, talks with Josh Horwitz, the Executive Director of the Coalition to Stop Gun Violence. They discuss gun policy and the 2020 election and beyond. Let's listen.
Josh, welcome to the podcast.
Thanks so much for having me. I'm appreciative.
You are a national expert on gun violence prevention. First, let's talk about the incredibly tumultuous last 6 months or so. What do we know about gun purchasing and rates of gun violence since the start of the COVID pandemic in March and in the context of what has been an extended period of social unrest?
It really has been a unique period between COVID, between the response to police violence and the elections. It's been a unique period in American history. One thing that we do know from the numbers is that gun sales have gone up starting in March and continuing through the latest numbers in September. And in some cases, in some of these months, gun sales have even doubled. That is very concerning because we know that there's a correlation between, gun availability and gun death, especially when it comes to suicide. As far as the numbers go, unfortunately, we have seen a significant rise in gun homicide in many cities across the country, both in blue states and in red states. It's very concerning. Some of those rises are quite concerning. So far, it looks like there's about a 15 to 20% increase in homicides. The suicide data lags a little bit. That's actually an issue for public health. We need to get that data more, but we can tell between the conditions, the calls to hotlines, that we are expecting when the final numbers to come out to have a grim year as well on suicide. And of course, we've seen all these instances of police violence, and police violence is gun violence. So we're having a grim year when it comes to firearms death, unfortunately.
We know from public opinion data that there's broad support among Americans, both gun owners and non-gun owners, for a range of different policies to reduce gun violence. However, gun policy continues to be a contentious issue in American politics. Let's talk about public opinion. Which gun policies do most Americans support, and where do we see more disagreement?
Well, I think it's important to note that most Americans support most of the gun policies that I work on every day, and that most of the people in the gun violence prevention movement work on every day. You see a huge amount of supports for things that are common sense, like background checks, like keeping guns out of the hands of domestic abusers. Those are the types of things where you see really strong support. Something that I spend a lot of my time on, extreme risk protection orders. Again, a lot of support, child access prevention, a lot of support. Where you see less support is in issues like an assault weapons ban. That doesn't mean we do get majority support. It's just not the 85, 90% that you see with background checks. And so there is a continuum there. And I think part of that is that I think for people who take a poll, what's an assault weapon? What exactly does that mean? Some of these things are more complicated to sort of understand. But for the things that I work on every day, and just so your listeners know, I think about my job is to advance risk-based firearm policy. Who's at risk from having a gun? How do you prohibit people from having a gun who is at risk of harm to self or others? Those types of policies. And the background check, of course, is the centerpiece of all that, has very, very high support.
Okay, let's shift to election politics and start with the presidential campaign. Can you give a snapshot of where each candidate comes down on gun policy issues?
Well, I would say it's easier for Joe Biden, Vice President Biden. He has a long history of working on this issue. He was the point person for President Obama after the tragic shooting at Sandy Hook, and he is very supportive of most of almost all the gun violence prevention policies that that I talk about: background checks, assault weapons ban, keeping guns away from domestic abusers, child access prevention, and a real public health approach, as well as some of the really important gun violence intervention programs, violence interruption programs like Ceasefire and Cure Violence. We can expect of President Biden to really support a whole panoply of interventions, which is extremely important. There's no one cure for gun violence prevention, right? It's a complex issue that needs complex solutions. And from having the Bureau of Alcohol, Tobacco, and Firearms to have more enforcement power, to federal grant fundings, to have people in the Justice Department who care about this issue, all the way to the policy issues. I think you'll see a Biden administration having a very powerful response to gun violence prevention. The Trump administration, you can tell what they've done now, which is to block any gun violence prevention initiatives. President Trump occasionally will nudge, and potentially for a minute or two indicate support for something like an extreme risk protection order after a major shooting, but then quickly backtracks. It made it harder for law enforcement to do their job. They haven't put any resources into the Bureau of Alcohol, Tobacco, and Firearms. Basically, they've punted on the entire issue. And I see no reason why this would change. In fact, during the campaign, President Trump has made a big issue about saying that he is the wall between you and your Second Amendment rights. He's made a big deal about going after Virginia, which has recently passed a really great group of gun violence prevention laws, and saying, he's a little too late on this. We passed the laws, but he keeps on saying, I'll stop anything from bad from happening. And I think he's doing that because he's trying to rally his base. That's what he has left, and he needs to do that. So there could not be a starker contrast between these candidates.
So it sounds like the types of policies on guns we might expect if President Trump is reelected is going to look very different from what we could see under a Biden presidency.
It will be very different, and the resources will be different. I mentioned earlier in this discussion that we have a lot of more gun sales. Well, to do that, you need to have resources to do adequate background checks. You need to close what's called the Charleston loophole, which allows a gun sale to go forward without a conclusive background check after 3 days. That law should be changed. But if it's not, you need the resources to conduct every background check within 3 days, which we don't have right now. So there, again, the contrast is incredibly stark. And I think Biden's plan is comprehensive and will save lives.
So as we know, there's some chance the Senate might flip in the 2020 election. How important is the Senate in anticipating what gun policy will look like at the federal level in the coming year?
Well, we've seen the House pass some really important legislation, including background checks this year, and only to be stalled completely on Mitch McConnell's desk. So if the Senate were to flip, we would see a lot of the House legislation finally move over to the Senate and get consideration in the Senate. Mitch McConnell has refused to bring any of the gun violence prevention initiatives to the floor, and that's kind of a tragedy. So having another new majority leader, especially that majority leader was Chuck Schumer, you would make sure that we'd have a much more robust debate about firearms in the U.S. Senate. Now, the bigger issue actually is what to do about the filibuster. And right now, the Senate works on 60 votes. And because of the filibuster rule, you need 60 votes to move forward. That is a way to stall legislation even when you're in the minority. It's been a long tradition in the Senate. I think you should think long and hard before you remove that. However, there used to be a tradition of working together among the parties, finding agreement and compromise about what could go forward. What you're seeing with Judge Barrett now is complete disregard for comity and respect. And that, I think, engenders an important review of the filibuster procedure now.
Much of the action on gun policy has occurred at the state level in recent years. Are there specific states you're focused on where we might expect to see some legislative action in the near future? And I know you mentioned Virginia a minute ago.
Well, I think what you're seeing now is that in blue states, you're seeing a steady march forward of gun violence prevention policy as new issues come to light. They're dealt with. So in states like New Jersey and Massachusetts and New York, now in Virginia and California and Washington State, you're seeing a steady progress almost every year now. I think the bigger question is what's going to happen in some of these purple states, swing states. How's that going to affect policy discussion? And I think Virginia is a good model for that. In Virginia, it used to be, the NRA was sort of in control. But when legislators realized that talking about gun violence and gun violence prevention actually got them votes, that helped establish a Democratic majority. The reason we haven't had a statewide Republican elected official in the last couple of cycles is because at the top of the ticket, from the governor to the attorney general, they're all talking about enforcing and implementing strong gun violence prevention policy, and that gets them votes. I think other state officials are starting to understand that. And so now the question is in these swing states, so think about Pennsylvania, North Carolina, in Michigan, what's going to happen in those states? How's the gun violence prevention issue going to play out? Are we going to be able to establish clear gun violence prevention majorities, which we don't have now? But I can tell you that, no one's afraid of the NRA anymore. And so people are talking about this issue, they're talking rationally about it. My prediction is that they'll help them gain votes, and then that will help us get better prevention policies. That may not happen fully in this election, but we're looking at 2022 as a real change point for state policy.
Okay, here's my last question. When I work on this issue as a researcher, I often get asked the question, why is gun policy a public health issue? I know your organization, the Coalition to Stop Gun Violence, uses a public health lens to look at gun violence prevention policy. How has this public health lens affected your approach to gun policy generally and in the 2020 election cycle specifically?
Well, I've been really lucky to be part of the Bloomberg School of Public Health at Johns Hopkins for quite some time now, and I'm an adjunct there, and I have great colleagues, and it really influenced the way I think about policymaking and the way that we use evidence and we translate evidence and we take translated evidence, we develop programs, we evaluate those programs. So what does that mean for gun policy? It means that we have a set of policies that we work with that are tested, that we have great evidence for, that we have experts to back up. And so the public health model for me, and think about it, is, we're affecting the health. When you think about policy, you're affecting the health of millions of people at a time. And that's what's so exciting about the public health model. What's happened in this pandemic is that people realize how important the public health model is. So as we've adopted our organization to think clearly and cogently in applying that model, the public is much more aware of it. I mean, the whole idea that we should wear masks, right? And the idea of thinking how important a vaccine will be, and the idea that we need to wash our hands, and that sort of education that goes around that model, that there are things that we can do that will prevent COVID. There's things we can do that will prevent gun violence. People know what the model is. So aligning our policies with the public health model, that means using the evidence base, translating the evidence base, applying the evidence base. The public's ready for that. And despite, I think, sort of the prevailing wisdom in Washington or with the president that Trump, that facts don't matter, when I talk to legislators, that's all they want now. They want the concrete data. They don't want the spin. They want to know, what does the public health model show? What does the evidence show? And so I think it's a great model for going forward. It's affected our advocacy greatly. And I just think for the greater world of public health, you've never been more relevant.
Josh, thank you so much for joining me today on this podcast.
Thanks for having me.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.